Hello, everyone, and thank you for joining us for this session of the 2020 International Nurse Researcher Hall of Fame. The International Nurse Researcher Hall of Fame honors Sigma Theta Tau International members who have achieved significant and sustained national and/or international recognition for their work, and whose research has impacted the profession and the people it serves. This year, we are recognizing 19 distinguished nurse researchers, and Sigma President Rick Ricciardi will be speaking with a few of them during this Hall of Fame session. The presentation of the International Nurse Researcher Hall of Fame is sponsored by Wiley. Wiley works with Sigma staff and editors to publish Sigma's peer-reviewed Journal of Nursing Scholarship and Worldviews on Evidence-Based Nursing, both of which are among the top nursing journals globally and are free to Sigma members as a membership benefit. On behalf of the Sigma Board of Directors, we thank Wiley for their continued support. And now, we have a brief greeting from Wiley. The three Hall of Fame honorees in this session are Dr. Connie White Delaney, Professor and Dean at the University of Minnesota School of Nursing in Minneapolis, Minnesota, USA. Dr. Carol Musil, Dean and Edward J. and Louise Mellon Professor of Nursing at Case Western Reserve University, Francis Payne Bolton School of Nursing in Cleveland, Ohio, USA. And Dr. Jacqueline Taylor, Professor and Director at the Center for Research on People of Color at Columbia University School of Nursing in New York, New York, USA. Full biographies for all our honorees are available in the Honorees and Award Recipients booklet in the Resources area of the conference website. I encourage you to read about the outstanding work of these researchers. Now, it is my pleasure to introduce Sigma President Rick Ricciardi as he talks with our honorees. Enjoy the conversation.
I'm Rick Ricciardi, President of Sigma, and very pleased to be with three new inductees into the International Hall of Fame, which is quite a prestigious and wonderful honor. And first of all, let me congratulate the three of you for that. And more importantly, thank you for your research, which is quite diverse. Your three programs of research are all very interesting and informative because I've had the opportunity, one of the things that I enjoy is I have the opportunity to read some of your papers and learn more about you before I do this. So I'm very impressed by what you all have done and probably will continue to do as you move forward. So again, congratulations. Today we're going to ask a series of questions and reflect on your wisdom, which we all need and look forward to. So I'm going to start by saying that most of the questions and interest we receive from Sigma, from members and other individuals that attend this conference, are focused around the interface between research and practice. That's where a lot of our members' interests are. So I'm going to ask all three of you this question, since there's only three, and I think this is an important question. And I'll start with Dean Delaney, if that's okay with you, Dean Delaney. We'll have you go first. So what strategies have you used to bridge the gap between your research and clinical practice?
Thank you for the question, President Ricciardi. I focused my research throughout my career in informatics. The very necessity of informatics being the voice and fostering the visibility of patients, families, communities, local to global, necessitated one, working in teams. So I have only ever worked in research teams and created research teams. And that also necessitated having academics, researchers, clinicians as part of the team. So the built-in synergy between the research and the practice for me was built in from the very creation of the team itself. I probably created about 6 teams across my career. The same principle is held throughout. So the benefits include, one, that the clinicians, as that key voice also of the patients, families, and communities, are right, if you will, at the table from the beginning, and inform and participate in the research, and also help inform this translation, if you will, into actual practice. So for me, it's been a synergy from the beginning.
Thank you. It's very interesting to me to get these perspectives because, like I said, all three of you come from a different research background. So the same question in terms of strategies used to bridge the gap between research and practice to Dr. Musil, Dean Musil.
Well, thank you very much. So my area of research is a little bit different. I do family caregiving, and most of my research has been in the area of grandmothers as caregivers to grandchildren. Mm-hmm. And so this is an area that is I would say, that kind of crosses over a number of different disciplines and may not be always considered uniquely nursing or solely nursing. So one of the strategies that I have used is to work with organizations and foundations and helping to spread the word about, first of all, issues related to grandparent caregiving, issues related to the children and the families, working with them in terms of identifying strategies that might be helpful for families. So it really is kind of a multi-pronged approach that may be a little different than some other people. But in addition to that, there's also a really important need for working with nurse practitioners and clinicians who are pediatric nurse practitioners, geriatric nurse practitioners, family nurse practitioners, in order to help identify and provide care for those families. So really it happens at a couple different levels.
Wonderful. I noticed that you were a PNP. Many people don't know that I started out my career as a PNP before I got my FNP out at the University of Colorado, which they like to say we created NPs because Henry Silver and Lee Ford being there. But I can give you a long history lesson on NPs because I was there and was a colleague of Henry Silver, who we became friends. So great. Thank you for that, Dean Musil. And Professor Taylor, I'm going to switch to you now and get your perspective on what strategies have you used to bridge the gap between research and clinical practice?
Yes, I'm also a PNP too, so we all have that in common. So I'm just, happy to be commiserating with my PNP colleagues here. So I definitely have used my clinical practice to inform my research questions. For example, when I was practicing as a PNP in Detroit in a mobile clinic, I found that children would come into the clinic with signs and symptoms of, lead poisoning. I checked their lead levels, and those lead levels would be below the CDC guidelines for lead poisoning and for treatment, the 5 milligrams per deciliter. And then after doing some reading and some research, I found that there's a condition called aryl-sulfatase A pseudodeficiency that occurs when you're heterozygous for the ARSA gene. Now, I didn't mention that my research has been in genomics of common and chronic diseases in minority families, particularly multiple generations of families. So this was very intriguing to me. And I also found through my reading that when you're heterozygous and have this aryl-sulfatase A pseudodeficiency, it can cause demyelinization of the neurons, which results in the neurological signs and symptoms that you see that are synonymous with lead poisoning, even at low levels of lead exposure. So when I tested these children in Detroit, about 44% were heterozygous for this condition, for this particular gene. And after more reading, I found that people of African ancestry were about 42% more likely to be heterozygous for this ARSA gene, but are rarely tested. So to answer your question, I use my clinical practice to inform my research, which is basically focused on precision health in minority populations.
Wonderful. That's fabulous. So you can see we have such a wide group here when you look at really important areas when you look at informatics and big data and artificial intelligence and natural language processing and how that's going to inform, and then bench science and translation and precision health in there, and then looking at individuals in the geriatric population and how to integrate community and caregivers involved in that. All three, from what I can see, if I had my crystal ball, three really, really important areas that are going to really push us forward as we try to wrap our arms around this thing we called healthcare delivery, which we are challenged not only in the US by, but across the globe. Many countries are struggling. So that said, which it leads me to a really interesting question on teams. And since you all are so diverse, and from what I can see, all three of you are interprofessional in your teams, I'd be really curious, and I'm sure our listeners would be too, when you build your research team, thinking about who you and what you're trying to accomplish, what characteristics do you consider in determining who and what you should include in your research team? Given that you all have three different backgrounds and different types of research, I'm curious to know about how you build your teams and how you develop your teams and how you look for your team members. So I'm going to turn us back to Dean Delaney to kick us off again on that one.
Building teams is a fascinating endeavor, and I've changed over the years. Initially, I focused on the characteristic of team members being quite predominantly their expertise. I've changed. Mm-hmm. I now view explicit expertise of all my team members as, and I only work in interprofessional teams as well, as basically the baseline. And what builds on that is an unwavering anchoring and focus in the people we serve. Individuals, families, communities, patients. It could also be the caregivers, the community, the breadth of the community, planetary health. So that unwavering focus and commitment then leads to a degree of integrity in each team member that, if I might say, rises above and empowers the expertise in a new way, might I say, a way that connects head and heart. I would also add to, and it helps dissolve what sometimes can be a component of teams, and that is the power of the ego. And there are many characteristics, but two other ones I would add is, again, this unwavering commitment to collaboration. And the last one I'll mention is transparency. Transparency of what each knows and doesn't know, the courage to share it, and a recognition and celebration of the integral contribution of every team member. whether it be the PI, whether it be students, whether it be people that are supporting the project. So those would be some of the key characteristics I look for in our team members.
Thank you, Dean Delaney. And building on that, is there anything you would like to add, Dean Musso, on the concept of teams?
I think I would just underscore the whole notion of integrity and the importance of integrity to the integrity of your research and your research project or the projects that you're conducting. It's very difficult to be a part of a team sometimes, and it's important that all people feel that they have a voice. So one of the key pieces for me is this complementarity of role, but also of personality. I really like to have people who are really smart in certain areas and who know it. I've been known for getting members of my team who other people might see as difficult, but I like that because it pushes us in new directions, and it sometimes creates a little bit of challenge, and that's good. So I think those are key elements. The whole idea of camaraderie has to emerge among the team, I think, for it to be really successful. People feeling like they have a place and a unique contribution. But most of all, I think it's this goes back to the sense of integrity, personal responsibility, that each person has a unique and critical role to make the research happen, and that everybody has ideas that should be evaluated for potential utility.
Wonderful. Thank you, Dean Musso. And moving it to Professor Taylor, and with your team, particularly with bench science and all the other translational science you're doing, be interesting to hear how you build your team and what you look for in team members.
Well, just building on what's already been said, I think that in addition to the expertise and looking for people that have expertise where I may be lacking to help round out the project, the most important thing is to find someone that is willing and wants to be collaborative and work for the greater good of accomplishing the overall purpose of the study and being of service to the participants that we serve. Because the work that I do is in the community, even though it's bench science, it's, bench to bedside to community is what I like to call it. You really have to be an integral part of that community. You have to find out what's important to the people that are participating in your studies and be responsible and responsive to their needs. So I think that's of greater importance, even more so than the expertise. But then I also want to seek out a person that has experience with working with minority populations and are very interested in doing this work, because it has to be purposeful for everyone on the team.
Wonderful. That's incredibly important advice. So we have about 5 minutes left. So what I'm going to do is I'm going to ask each one of you a different question so we can get different perspectives. And I'm going to start with Dean Delaney again, and ask you to try to keep it down to maybe less than a minute and a half so we can get through in 20 minutes. What advice would you give to novice researchers who are just starting out and are getting ready to kick off or jumpstart their research career?
When I think about novice researchers at the beginning of their research career, the first comment I would encourage each is that we are socialized to focus, and that's necessary. We're human beings. Our focus, and even when we work in teams, focus is essential. And I would advise that while one maintains focus, to continue to expand the understanding of the context within which that focused research is occurring and that you're leading, so that you're always sensitive and informed on the fit of that research within the bigger unfolding of how we advance health, and also cognizant of what is not being viewed, or if you might say, blind spots of our view on the subject. The second area that I would do a high encouragement is the fullness of courage to always ask the questions. They are gifts, and welcoming them also within your team, whether you're leading the team or others are leading the team, welcoming those questions are always ensuring new horizons. And last, energy, courage, and maintaining a balance and a planful approach to your research, and welcoming what might seem at first like aberrations, because in my own career, those aberrations actually were the wonderful, unexpected gifts of the whole next several trajectories. Thank you.
Wonderful, thank you. Dean Musil, the question to you is around, since Sigma is an international organization, and I frequently as president or when I was on the board got questions from members and researchers and junior and tenured researchers, how can we foster interconnections or a better network of researchers across the globe? So my question is, do you have ideas or any perspective on how we can facilitate collaboration among nurse researchers across the globe?
I think like so much of life, it's what happens locally in terms of making connections and networking. And particularly when you think about international collaborations, we all have former students, current students, former students, postdocs, colleagues that we meet at meetings. We oftentimes think that research has to be a large, heavily funded project, but many of the time it's the small projects that are very effective and very important for moving along either collaborations or generating new ideas and possibilities. So I would say taking advantage of opportunities to link up with people that you meet and find people that are in similar areas of interest. Again, this complementarity. And the other thing is, now I think we're going to be seeing a lot more collaboration now that we're all so much more used to this virtual world. It's very easy to connect with a person and or a research team and talk about research and figuring out ways to go ahead and either do consultations or collaborations and generating the research that needs to begin happening.
Wonderful. Thank you, Dean Musil. Now to Professor Taylor. I'm going to switch gears and move to a lighter note here because I'm a New Yorker. I grew up in New York, so I feel like I'm talking from one New Yorker to the next here.
Right.
On a lighter note, please tell us about the most touching, funniest, or most interesting experience you've had while you were conducting research.
There have been many. I think you have to approach research the same way you do as life, not to be so serious all the time. And it's always better to laugh than to cry when you experience certain things. So one example is I conducted a study in Mali, West Africa, in the Dogon tribes. And it's a very primitive area that, the tribes still live the same way that they've lived since the early 1400s. They only intermarry within their own 7 tribes. And I was there with my husband at the time, but this is a polygamous society. And so we would have to check in with the chief of each tribe before we started collecting data. And they always found it so fascinating that my husband at the time only had one wife. And they would keep asking, why do you only have one wife? And so I said, well, tell me, what are the rules about having multiple wives? And they said, well, you can have as many wives as you can afford. And I said, well, I think he's already over his head. So you have to keep things light and, just be able to, enjoy yourself while you're doing your research.
Wow. That was tremendous, and so many pearls of wisdom there that I know that our members, our audience will really gain from. So I'd really like to thank you all for taking the time out of your busy days to share your pearls of wisdom with us. And also, again, I'd like to congratulate you on your induction into the Hall of Fame. And I look forward to bumping into you when we finally get back to virtual conferences or we can have face-to-face meetings. So thank you all. I wish you much success. Please stay safe in this time of pandemic and be well. Thanks.
Thank you.
Thank you.